What is herbal medicine and what plants are used to make medicines? Phytotherapy is the oldest method of treating various diseases. It existed long before the advent of pharmacology. Now she has a lot of supporters. They believe that plants are safer than medicines, which are products of the chemical industry. From this material you will learn what is a place of herbal medicine in modern medicine, whether it is really possible to be treated with herbs. How did phytotherapy develop? Pharmacology is a fairly young science. It originated in the middle of the 19th century. However, this does not mean that people did not fight diseases before, they simply used plants for this. Information about their healing properties was mentioned in the writings of Ebers as early as the 2nd millennium BC. The greatest contribution to the development of herbal treatment methods was made by Sushruta, the author of Ayurvedic treatises. Hippocrates made an attempt to systematize knowledge about medicinal plants. Li Shizan, the author of the first Chinese pharmacopoeia. Galen, compiler of the first ointments and tinctures. Paracelsus, the first to use alcohol extracts from plants for medical purposes. In our country, phytotherapeutic knowledge was collected in herbalists, while the achievements of other states were studied in parallel. Having visited the Athos monastery, the inhabitants of the Kiev Petrosklaver compiled many manuals on herbal medicine. Herbal treatment methods. Today, the approach to therapy has changed, but from time to time people turn to natural medicines. Within the framework of phytotherapy, the following methods are practiced. Ingestion, usually drinking. For several millennia, recipes have been created for almost all occasions, so it is difficult to indicate the scope of drinking herbal remedies. External application, hot poultices, cold compresses, ointments. Used for dermatological, fungal diseases, for the treatment of injuries. Inhalations. They are used for diseases of the respiratory system, to facilitate the discharge of sputum, to relieve bronchospasm. Douching. Focused on women suffering from gynecological diseases. Microclysters. This refers not to cleansing, but to medical procedures. Help with inflammation of the mucous membrane of the rectum, dysbacteriosis, hemorrhoids. Injections and intravenous infusions are not practiced as part of phytotherapy. On the one hand, it is unsafe, on the other hand, it does not correspond to the natural concept of treatment. Types of herbal remedies. There are thousands of recipes. If you group them, you can derive the main forms of natural medicines. Decoction. Rigid raw materials are taken, roots, bark, less often, branches, and aged in a water bath for at least half an hour. It must be cooled, strained and used within 2 days if stored in an airtight container. Infusion. Soft raw materials are taken, leaves, stems, buds, flowers, and poured with already boiled water. The temperature depends on the recipe. The product needs to stand at room temperature for an average of 4 hours. You can store it for no more than a day. Herbal collection. Dried raw materials are poured with boiling water, similar to tea. It should be consumed at a time. Alcohol tincture. Vegetable raw materials are poured with alcohol or vodka, and the container is placed in a dark place for a month. The tincture is used in small doses, and the base allows you to store it for a long time. Ointment. Vegetable raw materials are crushed, mixed with a fatty base, Vaseline, butter, and boiled over low heat. Extract, plant extract. Active substances are obtained by water, glycerin or oil maceration. Phytopreparations are selected according to various criteria. Some are guided by well-known recipes and indications for their use, others by the presence of suitable ingredients in the required state. Types of medicinal plants. Medicinal are those representatives of the flora that contain biologically active substances that have a beneficial effect on humans. Of almost 300 species, such properties are observed only in 20,000. 250 species of medicinal plants have passed pharmacological tests and have been officially recognized by medicine as suitable for the treatment of diseases. They are called pharmacopoeial and are divided into three groups. Effective, used in medicine. Prospective, their efficiency is proved, but there are obstacles for wide application. Potential, a pharmacological effect has been demonstrated, but requires further research. Representatives of the first group are actively used in pharmacology along with synthetic drugs. The use of phytopreparations based on them is approved by doctors. What active substances can be obtained from plants? In leaves, bark, buds, and other plant elements, there are substances that are of particular value. Alkaloids. They act on the central nervous system, cardiovascular system, regulate blood pressure. Tannins. They have anti-inflammatory and hemostatic properties. Cardiotonic glycosides. Useful for the heart, improve blood flow, normalize pulse and rhythm. Saponins. Reduce cholesterol levels, facilitate sputum discharge, have a laxative and diuretic effect. Bitterness. Normalize the functions of the gastrointestinal tract, awaken appetite. Polysaccharides. Used to relieve irritation of the respiratory and digestive tract. Fatty oils. When taken orally, they thin the blood, normalize the stool, protect the liver. Used as a base for healing ointments. They contain essential oils, resins, vitamins and minerals. The main thing is to know in which plant which substances are present. Benefits of herbal medicine. Herbalists give many reasons why they prefer non-traditional pharmacology. First, it is safety. People do not trust the chemical industry, so they focus on the benefits of herbal remedies. Non-toxicity. No side effects. Additional immunity support. There is some common sense in this. So, it is undesirable for young children and pregnant women to take medicines. But they are also not immune from disease. Then folk recipes are used as an alternative. The availability of phytotherapy is also often noted. Raw materials are inexpensive, and if you have special knowledge, you can extract it yourself. At the same time, it is possible to pick up herbs that have a positive effect on several organs at once. Disadvantages of herbal medicine. Herbal preparations, prepared independently, can really help with many diseases. However, this advantage comes with a major disadvantage. Belief in the gifts of nature pushes people to completely abandon traditional methods of therapy. Not all diseases can be cured with herbs. They will not be able to replace antibiotics and antitumor drugs, they will not eliminate caries, they will not expel parasites. Doctors note that taking herbal homemade medicines can even lead to negative consequences. Allergies to individual ingredients. Unpredictable reactions to plant combinations. Overdose due to incorrect dosage calculation. Poisoning with poisonous specimens mistaken for medicinal ones. Aggravation of other diseases. Often, people who treat cystitis with cranberry juice end up in the hospital with a stomach ulcer, and supporters of the treatment of gastritis with St. John's wort end up in the cardiology department with a hypertensive crisis. Phytotherapy classes require extensive knowledge. It is not enough to remember which plant helps against which diseases. It should also be borne in mind that its use can affect other organs and systems. Rules for collecting herbs for treatment. Herbal preparations, teas, ready-made syrups can be found in a pharmacy. However, true advocates of herbal treatment prefer to collect raw materials on their own. They know a large number of rules and strictly follow them. Here are some. Pick the right time to collect. The bark is collected during the period of sap flow, the roots, either in early spring, before germination, or in late autumn, after the shoots die off, the buds, until they have blossomed, the leaves, before flowering, the flowers, during flowering. Assess the condition. The leaves should not be damaged, and the flowers should not be wilted. Roots up to 3 cm in diameter are suitable, thicker ones are not, because they are devoid of nutrients. Consider the weather. You need to go for grass in dry weather. After the dew has disappeared, the bark, on the contrary, is collected in humid conditions. Use a basket. Cellophane bags are not suitable for this purpose, the plants in them will quickly begin to rot. Experienced herbalists never collect raw materials for future use. At one time, they bring as much as they can process, rinse, dry, place in a dry and ventilated place. Principles of effective herbal treatment. Although we are talking about alternative medicine, it is also based on a scientific approach. If you systematically approach the preparation of a therapeutic regimen, you can get the desired results. The main principles that phytotherapists adhere to are: use of small doses. It helps to control the reactions of the body. Doses can be increased gradually. Gradual complication of composition. First, it is better to use single-component drugs to track their effect. Multi-component fees are introduced over time, as you become familiar with individual ingredients. Accounting for the time of day. Tonic plants should be taken in the morning, invigorating, in the evening in order to avoid jet lag. Infusions and decoctions with a diuretic effect are drunk in the morning so as not to get up at night. Reasonable combination. Herbs should be combined with each other and not harm other organs. The most important principle is the secondary nature of phytotherapy in relation to the traditional one. The main therapy should proceed within the framework of official medicine and under the supervision of a doctor. Folk remedies are allowed as an addition to the main treatment and support during the rehabilitation period